Good day, ladies and gentlemen. This is Richard Nevins. I'm an independent insurance agent here at Rima Insurance. And again, I'm here trying to clarify and simplify Medicare and the parts that make Medicare what it is. We've spoken about Part A, Part B, Part C, and today we're going to be talking about Part D as in David. And Part D is nothing more than prescription drugs. So we're going to be speaking a little bit about that, diving into it so you can understand the verbiage, the things the terms, the thing that makes it what it is. Now, every Medicare beneficiary receives a certain credit per year that renews itself. And for this year, 2021, the credit is $4,130, and that's the amount applied towards your prescription drugs. And these types of benefits are managed by private carriers such as Humana, Care, United Healthcare, and different carriers that are out there. And of course, we do represent them, and we can help you through that process if you need some hand holding. Now, just so you can know, the prescription drug program can be activated in different ways. The first way it can be done is through a Medicare Advantage plan, which is the Part C we spoke about in the previous video. And MAPDs is nothing more than the Medicare Advantage with a prescription drug program attached to it, which activates it and manages it. And for the most part, there is not an additional cost with Medicare Advantage plan, and it does provide the prescription drug coverage that you require. So when you see MAPD, it means that the PD prescription drug plan is also attached to the Medicare medical portion part of it. Now, if you see an MA plan, it means that the PD is not attached to it, and that's something you need to look at. So it's very important that you look at these pieces, because these nuances, these details, they can affect you. The other thing is that if you do take a Medicare supplement plan, which is a Medigap plan that manages that 20% that Medicare doesn't cover, they pick that up, and you pay an additional premium for that, you would have to get a prescription stand-alone program, okay? So, because usually supplements do not include it. Also, you have the Medicare savings account, which is very similar to a health savings account that people under 65 or that don't have Medicare have. There's Medicare savings account, and they do not have prescription drug programs either, so you would have to get a prescription drug program. Now, a lot of people say, Richard, do I need to get it? Well, I mean, you don't have to get it if you don't want to, but if you do come on board later on, your initial enrollment period, you're going to be attached with a penalty. So that's something you really need to sit down and look at. I've had a lot of people that say, I don't need it right now, I don't want it right now, and they come on board later and they get that penalty, and that penalty is for life, just like the Part B is in boy. So it's important that you know these details. Now, if you have creditable coverage through your employer, you don't have to worry about that if the employer does include a drug program with their plan. Okay? So I know I said a mouthful, guys. That's why it's important that if you need some help, just give us a call. 469-250-8061, 469-250-8061, or you can go to rnevins.com and you can click on Contact Us, fill out a form. It'll come up straight to us, or you can email us, and we can help you through the process. Now, so you can understand a couple of things, and I just wanted to go over this, is that every month, if you do activate your prescription drug program, you will receive a statement. It's similar to a bank statement, but for your drugs. So basically it lets you know how much of those $4,130 are left, how much has been used, how much is left, how much you've paid in co-payments, how much the carrier has paid, and how much that prescription cost. So that way you can budget yourself accordingly and see when you're getting close to that donut hole, which I'll explain later what that donut hole is. Now, another thing that I wanted to talk about were the terminology. Part D terminology is important that you understand it, because it breaks down the different parts. So you have formulary. Formulary is nothing more than the drug list. And every prescription drug carrier has a different formulary, but they all have the medications that's required per category. terms of, you need things for high blood pressure, you need things for glucose management, if you need things for anything that encompasses medical conditions has a category, and every carrier needs to provide prescription drugs for every category. So there's going to be medications. Now, are all medications on every carrier's formulary? No, they're not. That's why it's important to talk to a competent professional. Get that list of prescription drugs, cross-reference it with the carriers, and see which one is more advantageous for you. Which one will extend that credit? How much are those co-payments? Is there a deductible attached to that co-payment? A deductible attached to that medication, things of that nature, and that way you can budget yourself and know exactly what you're walking into. This is very important. Another thing is prior authorization. A lot of people think that, just because you have the plan, it's easy to access certain medications. No, you'll need prior authorization, which means that the doctor needs to request authorization for that prescription drug to be able then to prescribe it. And on the formulary, it usually tells you, or it indicates, what drugs require that prior authorization. The other one is step therapy. And step therapy is nothing more than if you are prescribed a certain medication, they will put you on what's called a step therapy process. They'll give you a certain milligram and see if it works, and they'll continue to move you up to the dosage that has been recommended, and to make sure that they're following proper protocol per the carrier. So that's very important also that you know what that means. Quantity limits, things that, for example, hydrocodone, codeine, things that have to do with opioids, they do have quantity limits. They can give you 60, 90 per prescription to be able to control that substance. So a lot of carriers do have that. Also, if a medication is not covered, or a medication limits the quantity, but it's required that you take more, there are what's called exemptions. You fill out an exemption form, the doctor helps you out with that process, it's submitted to the carrier, and they look at it, and if it's necessary, they'll do the exemption. So these are things that you need to know. It's not as cut and dry as people think. There are processes when it comes to your prescription drug management. That's why that list should be made. It should be cross-referenced with the different companies and see which one is the best fit for you. And every company does have deductibles. This year, deductibles can't be more than $445. So that's a good thing. So you'll know what's the most you'll pay for your deductible per year. Okay? So remember, your deductible is the highest it can go. Is $445, and the credit for 2021 for your prescription drug coverage is $4,130. Once that expense has been made, that's when you go into the donut hole. Now we're going to talk about tiers. Now usually it's divided between tiers 1 through 5. All right, and 1 tends to be your more cost-effective generics, and for the most part, they're zero when it comes to the copay. Tier 2 tends to be a little more expensive, but they're also generics. Tier 3 are your more cost-effective brand names. Tier 4 are your more expensive brand names like Genomet, things of that nature. And then Tier 5 are experimental drugs. So those are your 5 tiers. That way you can know every formulary has tiers, all of them. And some formularies will put a certain medication at a tier 2 and you get a good price break on that, but others will have a deductible attached to it in tiers 3, 4, and 5. And it varies by carrier. It varies by your prescription drug formulary. So that's very important that the research is done before it's placed. You can do it on your own. Absolutely, you can go to Medicare.gov, use their calculator. They do have a very good one, but I would recommend speaking to a competent professional, and just give us a call. The consultation is absolutely free, and you are not charged for it, and we'll handhold you through the process. Now, another thing that I did want to talk about and go a little more in depth in is the donut hole. Okay, and usually in the donut hole, that's the gap, and usually begins when you or your plan has paid out those $4,130, which we spoke about, and at that point you end up paying 25% of the cost of the prescription drug. Your plan pays 5%, and usually you get some kind of discount on brand name drugs. So they do work with you, and once you come out of pocket $6,300 or $6,650 up, if I'm not mistaken, then you fall into what's called catastrophic. Once you go into the catastrophic, you end up paying 5%, or $3.60 for a generic, or $8.95 for a brand name. Okay, so these are kind of the numbers we work with. You have your initial coverage period, you have your coverage gap, or the donut hole, and then you have your catastrophic coverage. And I put all this information here so you can take a look at it and understand what it means. But this is very important that you understand what it encompasses, what it covers, the terminology it uses, so you can prepare yourself accordingly. Now, if you have any questions in regards to this, no problems. Give us a call, 469-250-8061, 469-250-8061, or you can go to rnevins.com, and we will be more than happy to help you. The consultation is absolutely free. And there's another topic that I wanted to bring up, which is extra help for prescription drugs. And a lot of people don't know about this. If your income is under a certain amount for 2020, if you're single and your income is under $18,735, you would qualify for additional help from the state to be able to offset the cost of your prescription drugs. So it does bring it out substantially. And if you are married, the numbers are $25,365 as of 2020. I haven't gotten the new numbers yet, but if you're under that amount, you would also qualify for extra help to be able to offset the cost of your prescription drugs. So there is help out there, and I will include a link under this video, so you can click on it, go directly to limited income subsidy, the extra help page. You input all the information, submit it. It's very easy. If you need hand-holding with that, just give us a call and we'll help you through that process too. So there are ways to offset those costs. So guys, this is Richard Nevins. If you need some help, some hand-holding, don't hesitate to contact us, 469-250-8061. It can get confusing. It can be challenging, but if you have someone that has been in this for a long time, which we have, that understands the systems, which we do, it can simplify a very complex process. So this is Richard Nevins. Hopefully you're doing well. Take care of yourself, of each other. Stay safe, stay sane. And if you have any questions, don't hesitate to contact us.